Hello, we are going to be presenting our poster on hip compressive forces and range of motion in the gait cycle for 3 different shoe cushionings. And my name is Sydney, and I worked with Hernan and Kyle on this poster and this project. And we're all from the engineering department at Cal Poly. All right, so a little bit of background information. We're looking specifically at labral tear indicators and risk factors. And labral tears are one of the most common sources for inner hip pain in non-arthritic patients, which is especially prevalent in younger athletes in high impact and repetitive sports. And labral tears are caused by a rip in the cartilage lining of the cavity in the hip socket that lines the bone and the socket. So this usually provides a cushioning. And when this is torn away from the bone, it results in intense pain and debilitating effects that could potentially cause arthritis down the line. There are no specific studies showing and proving this. However, it is thought to potentially cause arthritis later in life. Common daily activities such as walking and other repetitive activities can cause impingement in the hip socket that can result in future functional impairments such as labral tears. And this suggests a direct correlation between gait patterns and hip joint injuries.
And so the reason why we're particularly interested in different shoe cushioning types is because gait patterns themselves have been proven to be heavily influenced by the shoe cushioning in the individual's shoes. And this has been proven and supported by an orthopedic study that was done in a hospital in Berlin, Germany. It was conducted by a team of researchers and doctors who were looking to see what type of shoe cushioning is best for elderly patients. They looked at one elderly patient with a arthritic hip implant and found that shoes with harder soles are disadvantaged to gait stability. And although this doesn't necessarily, they didn't find a direct correlation between hip injuries and the different shoe types. Gait stability is one of the crucial factors that affects pain in hip arthritic patients, which could suggest a further need for research, and which is what we're trying to answer today. Does shoe cushioning affect the hip joint injuries?
And then another background research that we found was that certain muscles influence the hip contact forces. These are the gluteus medius, the gluteus maximus, the rectus femoris, and the biceps femoris. So these are muscles that heavily influence the hip contact forces. And then moving over to the objective, the goal of this study was to analyze the different gait patterns for varying shoe sizes, for barefoot, medium, and high cushioning. We acquired data from Cortex to analyze these hip compressive forces and extension angles, as well as the EMG data for vastus lateralis and biceps femoris to identify the muscle engagement, whether it was on or off during particular times of the gait cycle. So our hypothesis was that the high cushioning would be the best choice overall in preventing the high risk factors of labral injuries.
All right, and moving to the methods. This study included 7 female participants with an average age of 19.4, an average weight of 65, and an average height of 166 centimeters. Their shoe size was 8 to 8.5 women's shoe size. The equipment consisted of 12 camera motion analysis system using Cortex software to capture the kinematic data. There were 4 force plates used to collect the kinetic data for the gait experiment as well. The procedures included an initial PAR-Q health screening form to ensure none of the participants had any underlying health conditions that could potentially cause issues later down in the study. An enhanced Helen Hayes marker protocol was used to place 32 retroreflective markers on various anatomical markers on each participant to determine the kinematic data tracking through the camera system. The EMG sensors were placed on the biceps femoris, gastrocnemius, vastus lateralis, and tibialis anterior of the participant's dominant leg. There were a total of 4 gait trials conducted for each shoe type and each participant at self-selected walking speeds. Our outcome measures include the kinematic data processed in Cortex software and smoothed using a filter, a 4th order Butterworth filter, and a cutoff frequency of 6 Hertz. The kinetic data was calculated through the kin tools in Cortex, and this data was then exported to MATLAB. The EMG data was also taken from Cortex and exported to MATLAB. Force results were normalized from newtons per kilogram to newton per newton and interpolated to one full gait cycle, which is heel strike to heel strike of the dominant leg.
And so to talk a little bit about the statistical analysis that we performed on all of the Cortex data that we had. So obviously our independent variable is going to be the shoe cushion level. That's what we're testing to see if there is a difference between the means of. So again, that's barefoot, medium, and high cushioning. And then we have our dependent variables. That's what we're actually measuring. And that's going to be the hip flexion extension angles, the hip mean compressive forces, and the EMG on-off timing for bicep femoris and vastus lateralis. And then on the side there, you can see that there's those are the two types of shoe cushionings that we use. So we have medium and high cushioning. And then also for the actual statistical part of the analysis, we used a two-way repeated measures analysis of variance, as well as a post hoc Tukey test to compare and see if the means between each of the groups, so high, medium, and barefoot, to see if those means were different. And then as per standard statistical analysis, we used a p-value of 0.05 or less to determine whether or not these difference in means was statistically significant. And then we also use Minitab to perform this, which is a pretty standard statistical software.
So moving over to the results, after we averaged and interpolated all our 7 participants and their given trials, we normalized the compressive forces for all the participants, and we plotted the barefoot, medium, and high right hip compressive forces with respect to the percent gait cycle. Obviously, we found that visually there's really no significance in all shoe types. And then once we ran our statistical analysis, we yielded a p-value of 0.426, which showed that there was no significance between the 3 different shoe types. And then moving over with the range of motion, we also did perform a statistical analysis on this, and we found that there was also there's no significance between the 3 different shoe types. On the plot, you can see the range of motion in degrees. We also attached a standard deviation of 1 for the 7 participants.
Yes, and looking at the EMG data, you can see in figure 4 that we have theoretical EMG muscle activation during the gait cycle. And from this, you can see in table 1, we determined the percent on for the biceps femoris was 24%, and for vastus lateralis was 33%. And the red data in the table 1 corresponds to the data ran through the code to find the percent on. And when comparing it to the theoretical, we found a large discrepancy there. So we wanted to go into Cortex and visually inspect the raw data to determine a more appropriate number for this. And so you can see that in the green data on table 1, which was from the participant from May 15th-02. And we determined that the MATLAB code had a threshold that was too low for the raw data in Cortex because there was a lot of noise that was picked up as saying it was on when it really wasn't. The vastus lateralis p-value was 0.1619, and the bicep femoris p-value was 0.649, which shows no significance in either for any of the shoe types.
So in a broad sense, we did not find any statistical difference between the 3 shoe types. And that ultimately led us to the conclusion that there's no effect that shoe cushioning has on minimizing the risk factors for labral tears. And comparing this to the study that we talked about in the background, it does align with their conclusion that there wasn't any correlation between hip joint injuries and the shoe cushioning type. However, the p-value that we got for range of motion was 0.149, which could indicate that with a higher statistical power and larger sample size, there could be a detected statistical significance, but we don't know from this study. And then going on to the limitations of this study, as I just mentioned, there was a relatively small sample size. Our participants were only female, so it was a little bit limited in variation between participants. And then the EMG sensor data encode, as Sydney talked about, wasn't great, as well as the activity that we were able to study was only walking, which labral tears can come from any repetitive motion in the hip. So we're a little bit limited there as well. As far as strengths, we did have 7 participants compared to the 1 participant in the orthopedic study that we mentioned. And then also the Cortex motion captures that we found or that we used were clean. They captured fluid movement. There was no problems with the markers, and we were able to easily process them as well.
And moving on to our future studies, We feel that maybe analyzing different activities which have different biomechanics, such as running or jumping, might yield to different results. Obviously, including more participants and varying the gender would give us better results. And then spending more time with the raw EMG data and correcting the MATLAB code, which we obviously didn't have the correct threshold on the MATLAB code, which yielded us incorrect results. And then obviously conduct a better study with the EMG sensors on the gluteus muscles, which contribute a significant amount of the hip contact forces.
All right, and these are our references. Thank you for watching.